You ready? You ready? All right. Good morning, and thank you all for being here for this community update on the novel coronavirus and the disease it causes, COVID-19. While there are still no cases of COVID-19 confirmed in Lincoln or Nebraska, the picture across the globe and our country is changing rapidly. This weekend in Washington State, we saw our nation's first 2 deaths of individuals who did not contract the disease through travel and who had no known contact with anyone infected with the disease. It's important to note that both of these individuals had underlying health conditions, and our hearts go out to their families. While the coronavirus is a very real public health threat, local residents can find reassurance in the strong team of professionals from across our community who are partnering to prepare and protect us all. The Lincoln-Lancaster County Health Department serves as the lead agency in these community-wide preparedness efforts. The Health Department has comprehensive plans in place to address potential health threats, and they are following those plans. Local health officials have been working proactively with community partners for weeks, and many of those partners are represented here today, and I want to thank them for joining us this morning. Our current goals are to minimize the local impact of COVID-19 and to provide our residents with the accurate and up-to-date information that they need to make informed decisions for their families. We plan to keep the public informed through 3 main channels. The first is that the most timely and accurate information will be available on the city website at lincoln.ne.gov. Our city website links to valuable information from the Centers for Disease Control and Prevention. Second, our health department has established a hotline for questions about COVID-19, and that hotline number is 402-441-8006. And third, we will continue to hold community briefings like this one as needed. At this time, there is no impact on critical services in Lincoln and Lancaster County, and it is important for everyone to know that we have measures in place to detect any cases quickly, to minimize transmission of the disease, and to guide our community's response. Next, I would like to call up Pat Lopez, our interim director of the local health department, to provide additional information about the work that she and her team have been doing and will continue to do to protect the public health. Pat?
Yeah. Okay. As the mayor said, the health department is closely monitoring coronavirus or COVID-19 activity. We are actively working with the Centers for Disease Control, Prevention, and the State Department of Health and Human Services and our local health departments across the state to monitor what's happening. I understand that at least one media outlet showed a map this morning that had 19 cases in Nebraska. These are, of course, the individuals who were brought here for quarantine and possible treatment. We also want to let the public know that reports they hear in the media may be different from the latest numbers that they see on the CDC website. Current information suggests that person-to-person spread will continue to occur and more cases might be identified. And when you see a difference on the CDC website and what's being reported in the media is that until there's final confirmation at CDC, the cases are determined to be presumptive. So you may see 2 different numbers at one point in time. Currently, there are cases identified in the states of Washington, Oregon, California, New York, Rhode Island, and Florida. We are locally monitoring individuals who have returned to the U.S. from countries of concern that have been identified by the CDC. The latest information and guidance will continue to be sent to the medical community that includes physicians, hospitals, urgent care, and outpatient centers, to name a few. Healthcare providers will continue to ask patients with fever and respiratory symptoms about their travel history and potential exposure. At the health department, we have been responding to questions from the physicians, hospitals, clinics, nursing homes, long-term care facilities, and labs. We are currently planning a training exercise with the medical community for this week. Turn it back to the mayor now.
Okay, thank you. We have several members of the medical community here today, and I'd like to invite them to join us up here to say a few words. Would Lancaster County Medical Society, Dr. Michael Rapp, please come join us? Bryan Health, we have Russ Gronhold from Bryan Health. And from CHI St. Elizabeth, we have Derek Vance and Dr. Renuta Vikakananandan, and I'm sorry if I pronounced that name incorrectly, and I'll get it right next time. Before they speak, I just want to add that, or actually, let's go ahead and have them speak. So we'll have Dr. Rapp first to share a few words about what is happening with the Medical Society. Thank you.
Thank you for the invitation, Mayor and Pat. We appreciate it very much. I want to assure everyone that your physician community is following the lead of the health department very closely. Whatever advice they give, we are reaching out and we are following to the letter. I also want to assure you that the physicians of this community have always, during my 30 years here, stepped up and supported the community fully in every way. So it's what we train for in school, it's what we train for in our entire career. So whatever is necessary, Mayor, we assure you that the medical community is behind you all the way.
Thank you. Thank you so much.
I'm Russ Grunewald with Bryan Health, and I wanted to assure you as well that we're in full coordination with the other medical providers, both the physicians and St. Elizabeth, CHI St. Elizabeth's. We practice the pandemic response protocols that we have in place on a regular and routine basis. I'm going to ask Lisa Vale. Dr. Lisa Vale heads up our emergency response team in this process.
Thank you, Russ. Thank you, Mayor, for the opportunity to be here. I would just like to confirm that Bryan Medical Center is constantly aware of what's going on in the community and in the country. We have subject matter experts from infectious disease as well as emergency preparedness that have been monitoring this situation since early in January. We work with the health department and our other partners in the community to determine what our plans need to be so that we are ready to respond no matter what might happen in the Lincoln community. And we have pulled our resources together and we're meeting on a regular basis, monitoring the data from the CDC and other sources of truth. So be assured that we are here to support the community. Thank you.
Thank you, Mayor. Good morning. Derek Vance, President at CHI Health, St. Elizabeth and Nebraska Heart. I also appreciate Dr. Vivekanandam being with me here this morning. She serves as our system infectious disease specialist physician. So we also have been watching this very closely since January and to see where this goes. And, you know, the great thing about hospitals is we prepare. We prepare for this. We train for this kind of a situation on a regular basis. And with COVID-19, we have increased our preparedness for that. Some steps that we've taken as we keep several months of supplies on hand for disaster and emergency preparedness. We have increased those levels and are increasing those levels as we watch COVID-19 and its progress. We also, I think it's important to mention that we, along with other health systems, ensure that our staff are ready, that they're ready, that they have the latest access to information around the virus, and that they're prepared both at the hospital and at home so that if and when this hits our community, they're able to come and be at the hospital and be at their very best. Also very grateful for this community of Lincoln, being a very close-knit community. We enjoy a very close working relationship with the County Health Department, with Pat and her team, with the Department of Health and Human Services with Dr. Tierney, and of course working well with Bryan and other local healthcare providers in our clinics around preparedness.
Thank you. As an infectious disease physician, I work for CHI Health, and we have been working daily on how we can handle COVID-19 infections if we do have. We have been practicing drilling and also having many supplies for if there is a case. I think as an ID physician, one thing that I would like to emphasize is how can we prevent transmission? You know, one big one is to make sure we are washing our hands, so hand hygiene. If you're ill, staying at home. And if there is a concern that you may have been in contact with somebody with COVID-19 or recent travel, to call your provider ahead of time when you arrive if you're going to come to a healthcare facility. And also to reassure, most of the cases have been very mild, so that is also very reassuring that most people will recover at home without major complications. Thank you.
Thank you so much. Our health department is also working very closely with Lincoln and Lancaster County schools and colleges. And at this time, I'd like to introduce representatives from LPS and UNL. Eric Weber, Associate Superintendent for Human Resources from LPS, is here, and Josh Davis, the Director of International Engagement from UNL, is also with us. Why don't you go ahead?
Thank you, Mayor. Eric Weber, Lincoln Public Schools Associate Superintendent for Human Resources. At Lincoln Public Schools, we want to assure families that we are taking all the essential precautions and we have protocols in place to respond to an outbreak of communicable diseases within the schools. We have been working closely with the Lancaster County Health Department as they monitor this situation, and we will follow their directions. LPS has an infectious control committee that continuously monitors and works diligently year-round to make sure we're prepared. The Infection Control Committee includes community partners such as the County Health Department and local healthcare providers to monitor illnesses in the community and within our schools. They help us to guide our coordinated response in concert with those entities. We will continue to follow our protocols and communicate with families in two primary ways. First, our email and phone system, School Messenger, will be a primary source of communication, and then also our LPS website if there are any changes or concerns. Thank you.
Well, thank you very much, Mayor. Let me first just say how appreciative we are for the close coordination that's happened with the city and with the county. At the University of Nebraska-Lincoln, the first impacts of the virus have really been to our international travel, the travel that happens by our faculty, our staff, and our students. We're very proud that we're engaged around the world, and yet the safety of our students, it really comes first. And so we have canceled our education abroad programming in China, in South Korea, and Italy at this point, the three countries for which the CDC has issued their highest level of warning. We're coordinating very closely with the Lincoln and Lancaster County Health Department upon the return to the United States of any of those students to make sure all the proper protocols are followed. And of course, we are also home to more than 2,500 international students from all around the world. And so we're providing support to them in cases where their friends or family back home might have been impacted. So we continue our close coordination and are prepared to adjust and find flexibility in our operations if we need to adjust further.
Thank you, Paul. Thank you. The Health Department has and will continue to provide information to child care centers, the business community, and other organizations. And at this time, I'd like to introduce some of the business representatives who are here. We have Todd Wilchin from the Chamber of Commerce, and do we have Bud Seinhorst here as well from LIBA? We may not. Okay. Well, Todd, would you please come up and share a few of your thoughts? Thank you.
Thank you, Mayor, and on behalf of Lincoln Chamber. Last Friday, starting actually midweek, started communicating with the Health Department, looking for ways to communicate accurate information to our businesses here in Lincoln and Lancaster County. As Pat had mentioned, information is an important tool in combating issues like this that we face as a community. So we're very grateful at the Chamber to have a health department, have an emergency management department, a medical community, as well as the schools, all working together to make sure that we have a common common information that we're sharing, because a lot of times that's a key thing that we miss as a community, and a lot of communities aren't as fortunate as we are here in Lincoln. Obviously, we are going to continue to monitor the situation, encourage good hygiene at places of work and at home. Cough and sneeze etiquette and hand hygiene are very important. We're going to continue to actively encourage sick employees to stay home when not feeling well, but also prepare for possible increased numbers of employees absent. due to illness in employees and their family members, or dismissal of early childhood programs in K through 12 schools due to high levels of absenteeism and illness. And again, working with our employers to develop new tools to help their employees work remotely is a key important as we address this challenge. So again, thank you, Mayor, for everything.
Thank you. Thank you so much. Our first responders have also been briefed. That includes Lincoln Fire and Rescue, the Lincoln and UNL Police Departments, the Lancaster County Sheriff's Office, and the Red Cross. Kendall Warnock from LFR is here to answer any questions that you may have at the end of this briefing. We are also coordinating with our cultural centers, and I want to recognize representatives who may be with us today from the Asian Cultural Center, Sheila Dorsey-Vinton. If you're here, please raise your hand. Thank you. El Centro de las Americas, Romeo Guerra, if you're here, please, thank you. The Good Neighbor Center, Tom Randa, are you with us today? All right. Malone Community Center, is John Goodwin here? And the Ponca Tribe representative, Suzanne Mealer, if you're here, please. Okay, thank you so much. We all want to make sure that everyone across our community has the most accurate and up-to-date information, and that coordination, they really are leaving no stone unturned at the health department. We all want to know what we can do right now to prepare. Pat is going to continue to share health department recommendations, some of which you've heard today, which is just a testimony to the fact that we're getting good, accurate information to our partners about what we all can do best to prepare.
Okay, you've heard a lot of the recommendations, so I'm going to reiterate those a little bit. This isn't new information. We have been practicing these efforts and repeating them over a period of time, actually since 9/11. So what families can really do is prepare by planning a room in their homes where an ill person can be kept separate. Individuals should have a 2-week supply of essentials such as food, water, and medication. And the public can take the following steps to reduce the spread of any respiratory viruses, as we just heard from Dr. Vandekamp. That avoid close contact with sick people. Most importantly, please cover your mouth when you cough. If you're ill, stay home as much as possible and avoid touching your face, your eyes, your nose. And clean and disinfect objects around you, surfaces that may be contaminated with germs. But I can't emphasize enough the importance of washing your hands. This basic initiative is back in the 18th century, we found, to control infectious disease. Wash your hands. A good way to remember, I've taught my grandsons, is say the alphabet while you're washing, or say the ABCs, say the ABCs or sing happy birthday. So to let you know, that's the most important thing we can do, is wash our hands and cover our mouth. Before I turn back this to the mayor, I want to assure everyone that viruses do not target people from specific populations, ethnicities, or racial backgrounds. It's important to remember that we all base our decisions on accurate and timely information. So, Mayor?
I have spoken of our administration's vision to ensure a successful, secure, and shared future for all in Lincoln. And when serious health crises like the coronavirus arise, collaboration and communication across sectors of our community is vital to ensuring successful outcomes and ensuring the safety and security of all our residents. I'm really grateful for the strong collaborations between the leaders in this room and the organizations that they represent. The leadership and commitment on display here this morning, this coordinated effort, should inspire confidence among our residents that we are doing everything in our power to prepare and to protect them. We have reserved this time, 11 a.m. each day, to provide updates to the community for the foreseeable future, and we will do that as it is needed. So we will contact the media, put out an advisory should we need to, but we are reserving time to make sure that we are able to do that. So we want to make sure you're aware of that. And at this time, if there are any questions, we'd be happy to answer those. Yes, Mr. Johnson.
How should community members feel about sort of the unknown of the coronavirus and seemingly accelerating updates on its spread as it relates to Lincoln, and how they should proceed with daily life?
Yeah. Well, before Pat gets to more specifics, I will just add, she touched on it. Much of what the health department is encouraging right now in terms of emergency preparedness is something that they would encourage on any day of the calendar year and have for years. You know, we want families to have supplies of water and food and other essential items and medications, just as they would for any potential weather hazard. So that's just a basic fundamental way of being prepared for uncertain events in our community. And then with more specifically about coronavirus, I'll turn that over to Pat.
I think the important thing to remember is that there are no cases in Lincoln and there are no cases in the state of Nebraska. And when that situation changes, the public will know and they will hear it from us so that they know that information is accurate and reflects what's actually happening in the community.
Right, and as you may be aware, there are people being treated at our health centers in Omaha, and that's because we specialize in handling with these kinds of health emergencies, and all those folks have been flown in from outside our state. They weren't naturally occurring cases. Any other questions?
I guess for me, should people in Lincoln and Lancaster County be afraid that it's going to come here? Because it seems like more people are being affected on the West Coast, but like, is there an actual concern here in Lincoln and Lancaster County?
I think we have a concern as we see the virus spread. We just want to be prepared in our community for changes that may occur, and that's why we're advising people to be prepared. We have systems in place to monitor at the health department 24/7 with our provider community. Our citizens need to be really assured that we have actual very timely communication. We're available to the providers if there are any questions. We have a close linkage with the public health lab in Omaha. So if the situation would change, we will definitely be alerting the community. But I think what we know from past history is that it's important for us to be aware and be prepared. And by doing this, we can minimize any impact in our community.
Any other questions? All right. Thank you for being here. Thanks for all everyone in this room is doing to protect our community and help everyone be prepared and well informed. Thank you.